Hi, I'm Dr. Rob Silverman, Amazon best-selling author of Inside Out Health and host of Proven Health Alternatives. We've got a great episode coming with Dr. David Cruz from Web Exercises. He's going to share some clinical insights on how and why to implement rehab exercises. Hey everybody, Dr. Rob here, Proven Health Alternatives. I've got a great chiropractor, good friend of mine, Dr. David Cruz. Dave, how are you?
Oh, fantastic. Thanks for having me.
Thanks for coming on. I'm going to sit back and relax. It's going to be a lot of fun for me. I get to talk about you. I get to tell everybody how wonderful you are. And, I'm going to start. I want to read Dr. Cruz's bio. Dr. David Cruz, good friend of mine, practiced as a sports chiropractor for 18 years, treating athletic injuries from weekend warriors to professional athletes. He received his Bachelor's of Science degree in sports medicine and was team chiropractor for Dominican University, managing all spine-related injuries. He is a certified strength and conditioning specialist and a corrective exercise specialist. Dr. Cruz believes that patients want to participate in healthcare, and if given the proper guidance, they will succeed. I love that. I absolutely, positively love that. We have to get to that.
That one's for you.
I appreciate that. It was actually his idea that led to the foundation of his company, Web Exercises, in 2005. Web Exercises, which I use, provide exercise program management and patient engagement software for healthcare providers. To date, over 12 million exercises delivered to patients using the Web Exercises software. Well, before I ask you a question thank you for creating this. I use this every day in my practice, and my patients are benefiting from that.
Hey, I appreciate
the idea, man.
I appreciate that. It proves the concept, hopefully.
So how'd you hatch the idea?
Well, came out of need. Like you, practicing with patients, very important. People need to move, right? Movement is medicine. Exercise is medicine. There's a lot of taglines like that. And I think historically, there wasn't as much emphasis on exercise and getting to move. It was more particularly rehab-based. I've always felt that exercise should be incorporated to some degree with any sort of healthcare. And at the time, 15, 12 years ago, there was nothing out there. You would treat a patient and they would leave and you'd say, you know what, I want you to do this. And it'd be kind of, good luck, hope you succeed at it. Well, there was really nothing available to help patients improve when they're outside of the office. And so after searching high and low on the internet, and which was dial-up at the time, which was quite slow, I figured out, you know what, let's see if we can make this happen. And had a patient, happened to be a software engineer, and I had to talk with him, and that's where it started.
That's great. So let me ask you, why do you think, or do you think, and how did it come that chiropractic and exercise are a good match for helping patients, the synergistic approach between the two?
Yeah, so what I mentioned earlier, I think can apply to any healthcare provider, where you're a physical therapist, chiropractor, physician, even people, an acupuncturist. We all need exercise to incorporate. As it relates to my profession, particularly from a historical standpoint, going back to the mid-1800s, there was a gentleman by the name of Bernard McFadden who really preached exercise as really a tool for health. He wrote, had a magazine on it. He really felt that if you incorporate exercise, people will improve their health. A lot of the chiropractors from the early 1900s actually adopted a lot of his teaching called physical culture at the time. And so really, if we look at the roots of chiropractic, not only what we think of a traditional chiropractic adjustment or manipulation, really exercise is at our core foundation because they adopted the exercise in the name of physical culture early on, about 100 years ago.
Wow. I love the history. So let me ask you, what do you think are the most common exercises used by our chiropractic and physical therapy brethren? Give me all right, so lower back pain. 8 out of 10 Americans have lower back pain. What do you think are the 3 biggest exercises?
3 biggest exercises, I would say what's called the bird dog, which you're on all fours, hands and knees. You're lifting one arm, alternating leg extension as well. Another one is called a plank or side plank, which a lot of us are familiar with. It's a static hold. You're on your forearms, on your toes, holding that, or on your side, on the floor, on your elbow, and on your feet, forming this plank position. And then another one is referred to kind of as a curl up, or the researcher Stuart McGill proved that this exercise is great, which is kind of a modified crunch. The traditional crunch, you're on your back, you're curling up, kind of head, elbows to the knees. This is a much more modified, it's much more safe for the back. And if there's 3 exercises for everybody to do, I would recommend those just because from a literature standpoint, they're probably one of the most effective, and just from an ease of to do. You don't need any special equipment. You can do those anywhere.
Yeah, I love that you mentioned Dr. McGill, because there was an article that showed that there are 4 exercises, one of which was the brace, which we can talk about in a moment, and those 3 were them. How about shoulder, rotator cuff,
rotator cuff? Well, that's an interesting topic, because I think historically, if you look at the shoulder, there was so much emphasis specifically on the rotator cuff muscles. And we would do these exercises, which were called an external rotation and internal rotation. It's a very simple movement, which is a great foundation exercise. Exactly. And I think going back years, everybody did those, whether you recommend it as a chiro, whether you're a PT, you're an ortho, those are kind of the go-to. But if you start looking at the literature, what's really now becoming more important is just from a global perspective, what you need to do. And I want to tie in what we call more thoracic mobility, in the sense of nowadays for your weekend warriors, what do people do throughout the day? You're at a computer, you're on your smartphone, you're hunching over. And the more you tend around, the more it affects the shoulder. And I think everybody can attest to this. If we stand up nice and tall with good erect posture, if you lift your arms straight above your head, much easier than if you're in a really rounded posture. So I think the transition now, if we talk about shoulder, although those smaller movements are important, I think what's really critical is looking more globally at looking at thoracic spine and these other areas. And we can even tie in the core stability. So those exercises I told you about for the core a minute ago, those are critically important for shoulder, because that's where a lot of the stability comes from as well. So I think that looking more globally is becoming more important as a whole body, as opposed to this isolated focal approach.
So when you say more globally, I know exactly what you're saying. So let me clarify for everybody. I asked Dave about the rotator cuff, and most patients go, hey, it hurts right here, and you're probably going to pop a smile. 17 muscles insert on the scapula. So when he talks globally, he talked about the core, because if the core doesn't move, the core is a brake. It's not an accelerator. We can move our periphery. And you talked about the scapula. So it goes to the mantra that you and I have had multiple conversations with at different seminars. He who treats the side of pain is lost. So an exercise, would a Brugger be one of the bigger exercises, an neck retraction, those type of things?
Absolutely. With the Brugger, it's a matter of getting those shoulders back, good scapular posture, head alignment, right? So the head should be over the shoulders, right? In good alignment. Yeah, so absolutely. So when we start going out of that good postural alignment, it starts putting more stress on all these other areas, and then leads to a breakdown in symptoms and so forth. Yep, absolutely.
Now, having utilized web exercises for several years, one thing I like is not just the exercise, and that you can individualize exercise, which is a critical element to good outcome. The other thing I like is you have some explanations of conditions and syndrome, patient education. So if you could expand upon that just a little bit for everybody.
I appreciate you saying that, because it's critically important patients understand what they need to do and the why. Everybody needs a why. And we as providers, we know the why a lot of times, and sometimes we forget, hey, patients don't understand everything which we were just talking about right now with the posture and the Bruegers and everything we were talking about. So if we can provide a little bit better education for the patients, the compliance gets better, they're more engaged, they do their exercise. Because you're absolutely right, is that when patients don't understand, well, they don't tend to do that. So what we've done more recently is we've been developing more content, patient-facing content with handouts to describe what the rotator cuff is, what the symptoms are, what to do for it. We've even been developing some 3D videos that are really patient-focused to give the patient that exercise, the instructions and the understanding of why it's important. Because what you started the comment was about the right exercise. And that's actually where another founding principle is that the right exercise for the right condition, you get the right results. What we do as a company, Web Exercises, we help providers give the right exercises, because I understand on the web now, anybody can look up anything, right? But when you really provide the specificity based on that condition, that's where we start to see the difference in the outcomes.
Yeah, that's a great point because I know you see patients who work with a lot of doctors, and me in the trenches. What drives me nuts is when a patient comes in and says, "I saw it on the internet." One, as you said, and this is a big point, and this is where I really like what you guys do. One, it's not individualized, and two, sometimes the exercise is wrong, so that poses an issue. So, with that being said, it is truly critical that patients complement their office visit with correct exercise and a correct home exercise program.
Correct. Absolutely. And that's another, principle of what we do is how can we alleviate the doc in the sense of make it easier for him in the office, but also make that patient more successful. And that's why we've developed a platform where you as a patient can, on your phone or computer, get that specific tailored exercise program of those 3 or 4 exercises. You can view photos, instructions, you can view video demo, you can even put in sets and reps, or even type a comment into the provider. So if you, for instance, have a patient that's going on a business trip, you can send them their exercise program, and they might be doing those 3 exercises, the bird dog, the curl up, and the side plank. But maybe on the side plank, they had a little pain. They could comment, "Hey, Dr. Rob, I had a little bit of pain on the side plank." You can see that and actually give them a revision of the exercise program. So maybe a regression, a little bit easier version of it. So we provide that touch point so the patients are successful when they're not in the office. And that includes, hey, I understand that. As much as I try and understand about exercise, right, you're always learning. You can never get it always right. So we tie that into web exercises that we can communicate with that patient and hopefully make them a little more successful if they're having problems when they're not in your office.
Now, you said you could also use the good old phone, correct?
Absolutely. So any phone, whether it's Android or Apple or anywhere in between, we use what we call a mobile web browser, so you don't have to download anything. You get the email and you'll be able to access it on any device from Android to Apple and everywhere in between.
I wrote this down. What's one of the more important factors of making patients successful with their home exercise program? And you can't say having them do the exercise because we all know that's one of the biggest things. But share some insights. And those insights really are for doctors prescribing and also any patients or clients that are listening, why they should do it.
Yep. So that's a great question, because if you look at how patients remember, there's actually a whole field of study called health literacy, and it's what patients remember after they leave the doctor's office. And if you look at the literature, really patients only remember anywhere from like 15 to 20% of what you're talking about when they leave the office. And that goes across all industries, medical, PT, chiro, and everywhere in between. So a few things which I know help with regards to patients' understanding, at least on the rehab side, is that when you're working with a patient, if they are, let's talk about those rotator cuff or the mid-back we're talking about. As you're showing them the exercise in the office, it's really important to what we call cue them up, in that touch those areas. Make them aware of those muscles they're supposed to be working, because your tactile influence on them creates this memory link between the muscles are supposed to be working. So the muscles are supposed to be working, tactile cue them. It then gets them to remember more to try and reinforce when they're out of the office. Okay, this is what I'm trying to now think about. This is what I'm trying to remember what that feeling was. The other thing I think is really critically important is that as providers, a lot of times we want to tell the patient what to do. I need you to do these exercises. I need you to do this. As providers, that's just what we do. But what's, I think, really important from the behavioral change standpoint, behavior change for habits takes anywhere from a month to about 6 months, up to 283 days to change a habit. And so it needs a lot of reinforcement. So me telling the patient, hey, I need you to do this, when they're a little bit hesitant, that makes it hard. So what I've learned is that if you get them involved, involve the patient. And an example of that is, let's use those 3 exercises. So if you're my patient, Dr. Rob, I go, Dr. Rob, today in the office, we did 3 exercises. We did the bird dog, we did the side plank, and mid-gill curl up. What 2 of those exercises felt the best for you? Because you're going to need to do those at home. Well, Dave, I think the bird dog felt really good, and the curl up, the plank was a little hard. I said, okay, you know what, Dr. Rob, then I want you to do those too, because I want to make sure you're doing those as well as you can in the best form possible when you're not in the office. So what we've just done is flipped it from, I want you to do this, to what exercises do you feel you'll be successful at? And that gives the power to them to feel they are in charge of their home care. They're in charge of their health care. Because going back to the principle which I started in the beginning with, what you said is, yes, I believe patients will want to do things, and even more so the more information they get. So if we can give them the information in a way that they feel they're taking accountability for, and it's their responsibility instead of me telling them, I think that's something which can make it more successful.
Right. You're empowering the patient. And I think that's a critical element, or empowering the client. Now, one of the things that I use that you have that you really didn't expand on yet, I want to throw it out there is, so I have computers in every one of my room. But like you said, you can use the phone, you can use an iPad. And in that, there's several exercises that you can show a patient. So for instance, if a patient happens to be waiting in a room, if a patient's on a stimulant, if a patient is doing something very passively, they can watch. So you've got some videos. What I like, and I want you to really expand upon that, is the continuum of exercise. So what I know that you have, and I want you to explain, is the different phases of care. You know, you got your acute, your subacute, and your chronic. You have exercises for all of those. So if you could explain which ones and how you did that, that would be great.
Yeah, absolutely. So, one of our goals is not only to provide better platform for patients to be successful, but we want providers to be successful. We know, and I know, time is an issue. Time is an issue doing notes and authorization reviews and all sorts of different things. So how can we make it easier? Well, we've developed what we call progressions of exercises and even built protocols. We have close to 100 protocols for different conditions, from the neck down to the ankle, which means as a provider, as a patient comes in, if they have an ankle sprain, for instance, I can simply choose a phase 1, which is a beginning protocol for an ankle sprain. I can do that in a matter of seconds. We also have phase 2 or phase 3. And so we've really tried to make it simple so providers can get that program created in the simplest way. If somebody has a little bit more expertise like yourself and go, you know what, these exercises are great, but I want to add a couple different ones in, you have that flexibility too. But with regards to your question, yes, we've absolutely built in all sorts of levels of progressions, from really basic, simple, all the way and up to a little bit more dynamic for the patient.
And as I know, you these exercises right now, and correct me if I'm wrong, they're for chiropractors, physical therapists. That's your main
That's
people?
Correct. That's our main demographic, is chiropractors and physical therapists, because those are the two demographics that are mainly in the trenches, if you will, working with patients hands-on, one-on-one, or their staff is one-on-one. We do also have some ortho clinics. We have acupuncturists, massage therapists. We have some fitness professionals as clients. But yes, our core demographic are the rehab professionals, the chiros and the PTs.
That's great. So I noticed that you've got some exercises for different taping. So,
Correct.
A kinesio type of taping, not trying to use too many different names.
Yep.
Also, I see some exercises now. So very, very hot in the manual therapy that physical therapists and both chiropractors do are instrument-assisted soft tissue mobilizations. We have a litany list of that. So do you have exercises to go in conjunction with that treatment and the taping treatments and the such?
Yes, absolutely. So one of the things which we do try and really stay current with is, what does the literature say, as well as what is the trends that really seem to be moving the needle, if you will. And you're absolutely right. Kinesiology taping has been shown to be effective for a variety of different conditions, if you will, and now some soft tissue instrument assisted, as well as you have mentioned. So here's the thing. Those are passive modalities. Those are modalities similar to the chiropractic adjustment. What's critical is that just as the chiropractic adjustment or manipulation needs exercise, the taping needs exercises to reinforce, because the taping can be used both from a pain standpoint, from a swelling edema standpoint, or from a corrective exercise to help improve movement. But what that also needs to be followed up with is actual exercise. So yes, we definitely have these different modalities within web exercises, but what's critically important is that the exercise is always the cornerstone that is paired with those modalities. Yes.
So great. So you're fluid. You're moving with all these different things. So a couple of things I know I worked on you. I do a lot of concussions. So now you have some concussions. So all those people out there have or want to treat some concussions. You've got some gaze stabilization. The eye is a critical element and some others. And we're expanding
Correct.
on that, which is fabulous. I want to ask you another common. So
Yes.
we talked about shoulder pain. We
Yep.
talked about lower back pain.
Yep.
Got to talk about neck pain. Give me a couple of the exercises that are most
Okay.
common that you see the practitioners use for neck pain.
Okay, for neck pain, that's it's a great topic, because whether somebody's been in a car accident or sitting too long, they can end up developing neck pain. I think we mentioned proper posture. So we've talked about proper posture alignment. But what we're finding, though, from a literature standpoint, and this goes for any muscle group, if you don't use it, you lose it. The way the body works is after accident or injury, your body has this neurological loop to actually turn off muscles, because the body will turn off muscles in that injured area. You have what's called redundancy, or load sharing is more the term. Load sharing simply means if a certain muscle is injured, other muscles that overlay it and around it will take over. Well, that's okay short term, but the problem is that when you have recovery of pain, here's the key, is that the muscles which were shut off or not working because of pain don't automatically turn on because the pain goes away. And that is clear in the literature from the neck to the low back. So that's where those rehab exercises come in. When we talk specifically about the neck, there's a lot of research on what we call the deep cervical flexor. So when we're talking about the deep neck flexor, which is one of those muscles which is very deep to the spine, it's critical for the stability of the spine, and it's one of the muscles that, with pain injury, it'll turn off, but won't turn back on and start working again once pain has been resolved. And so back to the redundancy, I might be able to move my neck again, left, right, up and down. Those are those muscles that were load sharing or also being redundant for the deep ones. So the real simple exercise to help reestablish the deep cervical flexor, you would do it lying down. I can't lie down right now, but I'll kind of show you or talk to you about it standing up. So you would have lying down, good posture, obviously, and it's just a little chin nod like so. It's a little chin nod lifting up. I'm not flexing my head fully to my chest. It's a little chin nod and lift about an inch off the table. I know you're well familiar with it, Dr. Rob, but it's one of those exercises that I think is missed a lot. And it's a very targeted exercise, because when we flex our necks down, these big global muscles are responsible for about 80% of neck movement. Those little spinal deep flexor ones are responsible for about 20% of movement. So it's very easy those are missed, but when they're missed long term, you don't use it, you lose it. Atrophy sets in. Those muscles are responsible for stability. That leads to chronic instability and lack of stabilization, i.e. chronic pain.
That's a great takeaway. And maybe we could share an article or something at the end with that, because I know for me, lecturing, that would be a huge takeaway for a lot of the docs and a lot of patients, so they understand. So which leads to the last true exercise question, proprioception. Yes. Proprioception, as we both know, is basically your sense of awareness of where you are, the balance between your nervous system and your muscular system. Give me your best proprioceptive exercise, if there's such a thing.
Ooh, okay, so
one, I know there could be 10.
You're putting me on the spot. Let's do. Let me tie in just general exercise for everybody, right?
Sure.
So what I think proprioception is great in the sense of, a lot of times I'll get the question, how do it goes back to progression or regression. So when you progress somebody, you can either add more weight, right? I'm gonna get stronger. I'm adding more weight and resistance. But here's the thing: the intensity of the exercise is really dependent on the stability as well. Meaning, if I'm standing flat on the floor, standing with my feet flat on the ground, I'm doing a bicep curl with my arms. I then, same weight, stand on one foot. It becomes a lot harder. I have to tie in proprioceptive imbalance and core strength, okay? So the intensity of the exercise has gone up because I've changed the stability. What if I get on one of those balance boards and do the same curl with the exercise? I might have to drop the weight because the intensity of the exercise is changed by the stability. And so as we talk about proprioception awareness, you're absolutely right. I think proprioception awareness can be utilized for a variety of different things, whether it's neck, post-concussion, whether it is ankle, and everywhere in between. But I like to tie that in, if possible, to an existing exercise. And that's where changing stability of an exercise will absolutely change the intensity of it. So that's kind of my approach, if you will.
Okay, I love it. I love it. I think what's going on here is we've got so much good stuff. I'm going to get a part 2 with you. But before that, what's your 2020 vision for web exercises? Because we're already into 2019.
Great question. So for 2020, I think I come from the approach of we always have to evolve in any business or we're devolving. And so with that said, we're going to continue making great content for exercises, great patient education. But I think what's critically important is that if we can continue to help providers with regards to time management, making things easier in the office. So we're developing all sorts of digital questionnaires, from pain questionnaires to intake forms that the provider like you would be able to send to the patient and they'd be able to fill out digitally on their phone or their computer at home. So when they walk into the office, you already have their information ready to go. So again, usually trying to use technology to shorten and save time on some of those daily things you do as a clinician and provider.
Fantastic. So before we close, why don't you give everybody your social media, your website handles, all that. So I know how to get in touch with you.
You can find us on Facebook at webexercises.com. I think what is something that great for everybody to look at, it's just blog.webexercises.com. And we contribute and we write a bunch of original articles, and it might be anything from rehab to business. And the thing with our blog, though, is that if you're a consumer, it could apply, and if you're a provider, it can apply. So I think that's kind of a good resource to find some exercises and the whys, as well as some good tips from a provider standpoint as well.
Tell you what, this was great. As everybody knows, I use it. It's what I use in my office. We have to have a part 2, and I think part 2 maybe we'll get some people moving around in the back and showing the exercises, and maybe we'll even have some questions and requests for exercises. We got Dr. David Cruz from Web Exercises, Dr. Rob Silverman, always yours in health, proven health alternatives. See you.